Okay, the next is going to be the pelvic girdle, or the pelvic joint, hip joint, and the lower limb. This is a pelvic bone, also known as the coxal bone, and it consists of three parts. This major part, it's like half, which is the part that's not covered right now, the whole thing here. This is called the ilium, and you see a bulky bone back here, which is called the ischium or the ischium, and this is called the pubis. So ilium, ischium, pubis. Three bones together are making the pelvic bone. So you can see here a foramen here that's called the obturator foramen, and this cavity right here, it looks like a cup-shaped or like a half of a sphere, hemispherical shape, and this is called acetabulum for the articulation with the head of the femur. Acetabulum. If you look here, this is called the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. These are the spines that you're going to see here, and this is called the iliac tuberosity, right here. Okay, so around the acetabulum here, in front of it, this bone right here is called the pubic bone, and this is called the ischial bone or the ischial bone. The bulky one toward the back, the bulky one is very bulky. Compared to this is called the ischial or the ischial bone, and this is the pubic bone. And this is the ischial tuberosity right here, the big bulk, and this is the ischial spine. This is the ischial ramus. Here's the pubic, and you have two rami, superior and inferior rami, and this is the pubic tubercle right here. So the two bones should go together, two halves. This is probably the right, and there should be another one the left. And this surface right here is called the auricular or articular surface that articulate with the sternum. I'm sorry, the
sacrum.
The sacrum, I'm sorry. The sacrum, it should articulate like this. And right here, you should see the other one. So this is for articulation with this, with the sacrum. The next bone here, which is going to articulate, is the femur. And again, you have two heads. Here is two necks, I'm sorry. This is the head. This is the anatomical neck, and this is the surgical neck. So anatomical neck is the neck that's follow the head. And you see two tubercles here. This big one here, it's called trochanter here. It's not a tubercle, it's a trochanter, which is larger. So greater trochanter and lesser trochanter, and this is the intertrochanteric line. This is the shaft, and these are the condyles. This is the medial, and this is the lateral. How did I know this is the medial? Because the head is always medial. This is articulating with the body, so it's closer to the body. Same side is called the condyles, and these are the epicondyles. This surface here, right here in the back, the same as a tubercle, and this is called the popliteal surface, and this is called the patellar surface. So it should go like this. If you put it together, you're looking at the back, right, like this. So this is the popliteal fossa or the popliteal surface, and if you go to the front where the pubic bone is, you will see this is the patellar surface. So the patella should be here. You can put this like this. This is the femur again, and this is the tibia, and the fibula should go lateral like this. So femur, tibia, fibula. The large, huge bone, bulky bone right here, this is called the tibia, and this is the tibial tuberosity right here, and these are the articular surface with the condyles, with the condyles of the femur, and this is the intercondylar eminence. This is an eminence that goes between the condyles right here. This is the tuberosity again. This is the shaft. And we don't need to know much about the femur, except it goes lateral, and it is lateral. And because it goes lateral, the tibia is medial, so this is the medial malleolus, and this is called the lateral malleolus. So tibia, fibula. The next part, we're doing the foot over here, and if you look at the foot, you will see it as follow. The mnemonic to remember it is CCTN, CC10, CCTN, and you're starting also from lateral, but In the foot, the little toe, or the little finger or the little toe here, this will be the lateral, and the big toe will be the medial in this type. So this is the opposite of the foot, but we're starting laterally anyway, irrespective to this. So C 10 TN, like 10 cc's. C TN, CC 10, and then you will have 3 bones, 3 tiny bones that will be 1, 2, 3. The 3 of them are known as cuneiform, but just give you the lateral, intermediate, and medial. Lateral, intermediate, and medial cuneiform bones. So again, CCTN, and the rest cuneiform. 3 cuneiforms. Okay, the CC will be this and this. This is called the calcaneus bone, and this is the only bone that protrudes to the back like this. This is the largest bone of all, and sometimes you can see it separated like this. It's still the largest bone of the foot, and this will be the calcaneus, and it's very famous to hear calcaneal fissure. So if you hit your foot like this, you can have fracture of or fissure of the calcaneus bone. This is the largest of all. This is not the same as we did in the hand. So this is calcaneus bone, and in front of the calcaneus bone you have the cuboid, CC, calcaneus cuboid, and then on the other side you have those 2 bones here. And I'm not talking about the other 3 in the front. This is all cuneiform. So calcaneus, cuboid, TN, this will be the talus, and this will be the navicular bone. CCTN, calcaneus, cuboid, talus, navicular. And the talus, if you look at this model here, you see that the tibia is actually articulating with this talus bone. This part here is actually called a trochlea. It looks like a trochlea. So the lower end of the tibia will articulate with the talus bone, or the trochlea of the talus, same thing. It's just the upper surface of the talus. So the tibia articulate with, and both of them goes with the T. Tibia, talus. Tibia articulate with talus. The last 3 will be here, which is 1, 2, 3, or start from here, 1, 2, 3, always start from lateral, and the 3 of them are called cuneiform: lateral, middle or intermediate, and medial cuneiform bone. This is 7, the carbal bones with 8, and this is actually 7 bones. 1, 2, 3, 4, 5, 6, 7. The rest of the bones here, this will be the metatarsal bone, and always start from the big toe. So this is metatarsal 1, 2, 3, 4, 5, and same thing as we said in the upper limb. Here is 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, proximal, middle, and distal phalanges. And here you have only proximal and distal. You don't have the middle one or the intermediate one. So you have only 2 phalanges in your big toe. The last thing that we're going to talk about, and when we talk about the foot, is this is the right or the left. And this is easy. If you see the curvature here, this curving or this fossa here, it should be the opposite of the upper limb. It should be facing down. This is going on the ground. So, and if you look at this is the big one, the big toe, and the big toe has to be medial. Imagine or remember your own foot. The big toe is always medial. The other big toe will be like here. So this is the medial side, and this is the lateral side. This is the upper surface. So this has to be like the other one will be here. So this will be the left foot, and this is all about the hand and the foot.